What's up, Warriors? Coach Clellan here, and welcome to Health Huddle, what's working in health and fitness. Today, we're talking beyond your spine, your extremities, shoulders, knees, ankles, your joints. All of that moves your body. And if you run, lift, or even live an active lifestyle, your extremities matter and the care behind that does as well. Today, I'm joined by Dr. Josh at Select Chiropractic. So, welcome to Health Huddle, and let's get started.
Okay, thank you.
How are you?
I'm doing all right, man.
Great.
Yeah, so Dr. Joshua or Dr. Josh, I've been doing chiropractic for about 6 years now. Been in Kansas City for all of that time. Came to school here, planned on going back home, but met a pretty girl, stayed in Kansas City. But yeah, been doing chiropractic for about 5-6 years with a special emphasis on the extremities along with the spine. And I love every day of my work. It's fantastic. I get to help people move better, feel better, and live better lives. It's amazing. Yeah.
All right, so to get started, I want to ask you, what's one myth about chiropractic care and extremity care that you would like to debunk?
Ooh, myth about chiropractic care. I think the one myth about chiropractic care that I hear consistently, and I've heard this from some of my best friends too. Once I got into it, they're like, "Hey, is it true that like once you see a chiropractor, you're always going to have to see a chiropractor, right? Like, am I stuck doing it for the rest of my life?" It's like, so it's a yes and no to answer that question, because if you go see a chiropractor, if you go for, let's say you've got a rib out of place, you've got headaches, something like that, when you get that fixed, are you going to have to continue to stay in order to not be in constant pain all the time and have that issue? The answer is no. You're not going to have to like continue to stay on it to always feel good and to always like not have to worry about that pain just popping up
Yeah.
like immediately anytime you do something wrong. But when we look at kind of what your body does once you get, like, say, if you come in with a flared up issue, if you have a rib out of place, most likely that's coming out because of some bad movement patterns over time, and eventually got to a point where that rib is far enough out that it kind of snaps, finally slips, and you get that kind of severe immediate pain going on with that. It's due to a progressive build over time that
Okay.
kind of happens, and it's just due to bad biomechanics over time. It's bad movement over time.
Yeah,
Yeah,
especially like in this day and age, a lot of people
yeah,
have sedentary jobs, and it's
yes,
just
yeah,
you're sitting in this position.
yeah,
When you come home, you're
mhm,
getting on the couch, you're in this
mhm,
position, you're
yep,
never moving your body, and you
yes,
wonder why,
mhm,
hey, my back is starting to hurt. Well, what
yes.
have you been doing for the last 8 hours
Yeah,
or 10? So, yeah.
absolutely. So you'll get those snap pains, and a lot of times you'll get out of pain with a chiropractor and you feel great. It's, okay, my job's done. But a lot of people, once they get that main issue resolved, right? Let's say it's the rib pain or the headache. Once those are resolved, a lot of people tend to notice, like, hey, I'm actually moving a bit better.
Yeah.
They get less stiff at the end of the day. They notice that, like, hey, I can actually walk longer before I get fatigued, before my low back gets tired, because a lot of the things that chiropractic focuses on, it's not just that pain relief, it's not just the, hey, let's eliminate this inflamed issue you've got going on. It's get your body moving better and keeping it moving well and letting your body just be easier to use day to day. Because the fact of the matter is, most of us by the age of like 16, we just start sitting a lot, we don't move as much
Yeah.
as we're supposed to, and so the body gets stiff over time. It's harder to get up out of the chair. It's harder to wake up in the morning. You can't be as active for as long a periods of time. So, with that myth is, once I go to the chiropractor, am I always going to have to go? If you like, you don't have to do that all the time just to like keep out of pain. But a lot of people end up wanting to stay with the chiropractor, continue to keep up with it because they notice just an overall improvement in their mobility,
Yeah.
quality of life. And it's just because they're able to do more easier, do things longer, and it just makes your body last longer in the long haul.
So I want to say, like, how important is stretching? Because I
Mhm.
teach a full body restorative stretch and
Yes.
mobility class,
Mhm.
and on TikTok, I had this one comment about
Mhm.
this dude was like, stretching doesn't work for me.
Yeah.
And I explained to him,
Mhm.
he was like, when I'm stretching, my body hurts. I said, there's your body letting you know that you don't stretch enough. And over
Yes.
time, if you
Yes.
actually started stretching,
Yes.
you wouldn't feel that pain. But
Absolutely.
many people think we correlate stretching to pain
Mhm.
that is not working.
Yes. So the one analogy I like to use for a lot of people with, so like when you have pain with stretching,
Mhm.
or when you're extra sore with like that first workout after you haven't been doing something for a while, our bodies are kind of like hypochondriacs. They anything new, it
Yeah.
does not like it. It doesn't matter if it's the best thing for you ever. Like if you go get a nice massage that works on some muscular tightness, you're sore and all get out the next day. And it's not even necessarily that that massage therapist went in and went too hard on you. It's just your muscles finally got moved and stretched in ways that they haven't been for a long time, and your body sees that as foreign. That's a threat. That's weird. And so a lot of times when you're doing the stretching, when you're
Mhm.
doing things for the first time, it is going to be painful the first time you do it. It doesn't mean that's wrong, but as far as the question with how important is stretching for just overall body care maintenance, I mean, it's ridiculously important. Everybody tends to get like tight traps, tight hamstrings, tight quads. We'll get our deep neck flexors and our neck will get weak because we get stuck in this
So
forward
like this,
position.
especially in this day and age with
Yes, with the
like that,
texting, and
yeah.
that's a big reason why a lot of people come in with headaches that we see here. They get stuck in this forward position all the time because these heads that we carry on top of our heads, they're roughly about the weight of a bowling ball. So holding the bowling ball here versus
Over
back here,
time.
it's a
Yeah.
huge difference. But really, your musculature will get really tight in those sitting positions for long periods of time, or even with some of our people that are more labor intensive, like our construction workers and such, they tend to do very repetitive actions over and over again. So they'll get like specific muscle groups that'll be over recruited
Mhm.
versus other muscle groups that are not being used as much. So as far as the stretching goes, it's super important for overall body health and wellness, because when you have tight musculature, it doesn't allow the joints
To
around
move.
those guys. It
Yeah.
doesn't let them move, and that's where you get dysfunction. That's where you get restriction, and then over time, most of the time, that's going to lead to pain at some point. It's going to lead to something getting irritated somewhere down the line. So stretching is one of the best things to help prevent any flare-ups, prevent injuries, and just helps you move better overall. It's super important for everything.
Oh, you just touched on dysfunction. I want to
Yeah.
ask, how often are extremity dysfunctions overlooked in the fitness setting?
In fitness, I say they're overlooked a lot. I mean, when we look at kind of like so let's just like look at shoulders and your arms, right? That's what everybody uses those every day. You
Yeah.
use your legs every day too, but let's just talk about the arms. When we look at like the overall mobility of the upper arm, a lot of that motion happens in the shoulder, happens in the wrist. Those are two of our most mobile areas of the body. But traditionally, those two areas will get really, really locked up because as far as the wrist goes, probably about half the people out there have a job that is either using the computer a lot and they're typing a
Yeah.
lot, or they happen to be on their
On your
cell
phone.
phone a
Yeah.
ton, or they're even driving their car a
Mhm.
lot, right? And so you'll end up getting your wrist into these positions where it'll either get compressed this way, it'll get compressed this way, or it'll just be stuck in a, you know, in a specific position for long periods of time, and the musculature will get tight, and we just don't move it. So those wrists will get tight over time, and they don't move as much as they're supposed to. And then as far as shoulders go, shoulders are one of the most common things as far as like upper extremity injuries go. Like everybody knows somebody that's injured their shoulder, right? Most of the time your shoulder gets injured, it's just because of some improper positioning. I was just in bad position for the whole first part of this interview,
Yeah.
kind of being slouched forward like this. Because when your arm's back and open like this, you can actually get your
So
shoulder
the full range
through
of
its full
motion.
range of
Yeah.
motion. But as soon as we start kind of rounding our shoulders forward, getting into a position like this, we automatically start losing the range of motion. I can start kind of forcing through it, but I have to posture up my
Yeah.
upper back. But a lot of times in the gym, when guys and gals are setting up for any type of upper body lift, a lot of them start in these kind of forward positions here, right? And so they're kind of forcing their shoulders through these restricted ranges of motion, and they're working with wrists that have just been stuck at
Oh,
work all day
yeah.
long. So when you are working with shoulders and wrists that just are not mobile, they're not moving as well, where they're in those kind of impaired positions, when you're exerting that force through the lift, I mean, you're putting force through a joint that is not pliable, it's not moving well. And so rather than being able to transition that force well, a lot of that impact will actually hit at the wrist, it'll hit at the shoulder. And in particular with the shoulder, when you're getting in those kind of forward positions there, you're taking all of the strength away from your upper back musculature back here, and you're putting it all on the pressure in the shoulder. And that's where we get a lot of those rotator cuff
Mhm.
injuries, tears, like your sits muscles, the subscapularis, supraspinatus, just the little rotator cuff muscles that really just hold your shoulder from falling out.
Yeah.
Those guys get overworked and they get torn. They get you know just they get dysfunction. That's where a lot of shoulder pain comes from. So it happens all the time. It's just due to the wrists and shoulders not moving. The same thing happens with your ankles and
Yeah.
hips. Yeah, just you don't get good force, and when the motion in those joints is not happening, it shoots through. You'll get dysfunction, and I mean that's where injuries happen a lot of the
Yeah,
time.
and you
Yeah.
don't I think we tend to forget how much we use our body and like what parts of your body you use
Yes.
more than normal. Like for me
Yes.
personally,
Mhm.
I can tell when I'm stressed out because back here on my shoulder,
Yep.
it's like a knot.
Yep.
But then
Mhm.
over time, like I run a lot, so my
Yes.
hamstrings get
Yep.
tight. So
Mhm.
those areas I
Yep.
focus more on,
Yes.
and just trying to teach people how that you need to stretch your body in the
Yes.
morning and
Yes.
before bed because
Yep.
that will help over time. Like
Yes.
your muscles, especially if you're someone that's been in this position for so long, your
Hear
body
that
gets
all day
used to
long.
that.
Yep.
So when you start to like stretch it out,
Mhm.
you end up in pain, but it's because my body has been like this for 10
Mhm.
days or something, and you're
Yeah.
not doing anything else to it.
Right.
So yeah, I get that completely.
Yeah. Absolutely.
So in exercise science, we talk
Yeah.
a lot about regional interdependence,
Mhm.
one joint influencing another. Are
Yes.
you seeing that clinically?
Absolutely. So one thing that I've seen a lot over the years is knee pain. Knee
Mhm.
pain, it's super common. People get the crackly knees, ACL tears, PCL tears, meniscus tears. Knee injuries are super common, and knee pain just in general
Gym,
is
yeah.
super common. When you break down your lower extremity here, and we look at kind of what it's supposed to do, our ankles and hips, they're really flexible. They should be able to do a lot of motion. In particular, the hip. A lot of us don't move our hips nearly as
Yeah.
much as we should. If you ever want to see how much a hip should move, go watch a ballet dance. They show it
In
through its
full
full
range
range
of
of motion.
motion.
They
Yeah.
fully show it off, plus some extra too. But when we look at what I've noticed over the years as far as that regional interdependence and kind of what joints will influence others, I have found so often over the years that with your knee, a lot of the pain I've seen in office on the knee, it wasn't even so much that the knee itself had a lot of dysfunction. Because when we look at what your knee's supposed to do, your knee's supposed to go forward,
Forward
it's supposed to go
and
back.
back.
There's only two things it's supposed to do. It's not supposed to do a whole lot else. But when your ankle and your hip, which are both really, really mobile joints, when they start to get stiff due to, sedentary activity,
Mhm.
tight musculature, just because you're not stretching after the gym when you do work out those muscles and they kind of get those tight muscular adhesions. When you lose that motion in your ankle and your hip, and then you go walking, running, squatting, sprinting, you do activity with your legs, when your body needs your ankle and your hip to move and they don't move as well, they're going to go find that motion in the neighbor. And then all of a sudden, your knee, which is only supposed to be going forward
Forward.
and backwards,
Yeah.
it's being demanded to laterally flex,
Mm.
to abduct. Adduct, that's just fancy talk for like go in and
In and
out,
out.
like kind of
Yeah.
go side to side. And when that happens, your knee will get irritated. It will degenerate. You'll get some weird pulling forces on the patella itself. And so when the neighbors get lazy, it ends up really affecting that knee. That's one of those regional interdependency. It's like one of the biggest things I've noticed. You'll get that with elbows too,
Mm.
up here, not nearly as much as
Much
I've
as your
noticed it with the
knees.
knees. But I mean, you get the same thing with elbow dysfunction sometimes with your wrist not moving well and your shoulder not moving well. Each joint will influence the other. And I mean, across the spine, you'll find it if we have sections in the spine not
Mhm.
moving well right here, up above it and down below it has to work extra hard to make sure we're making up for the lack of motion there. And that leads to inflammation and wear and tear on those other joints. It happens at every section of the body. If something isn't moving, somebody else has to work harder to make up for it. And that leads to that inflammation, the degeneration, just a whole slew of things.
Yeah, like your body has to compensate it somewhere, and
Yep.
it just your body is truly a system. So it's like when
Yes.
one area lacks, okay, another one has to do double the work. And
Yes.
that's again, like you talked about injuries. That's how a lot
Yes.
of injuries happen, is because you ignored something for so long.
Yep.
Your body had to overcompensate in this one area.
Yeah.
And now not only is the original area messed up, the area where the
Yes.
extra work
Yep.
was put on it, that's messed up as
Yeah,
well.
because it's
Yeah.
getting overloaded and overused.
Yeah.
Yep. The whole thing.
So the whole title of this podcast is "What's Working in Health and Fitness." So
Yeah.
for you, what treatments or approaches are you actually getting results right now? And yeah.
Treatments and approaches. I mean, obviously, I'm a chiropractor. Chiropractic technique has been working great
Correct.
for
Yeah.
helping with neck pain, mid back pain, low back pain, overall joint mobility and ability to move throughout the day. So I've obviously found a lot of success with that because at the end of the day, we evaluate the body. We try to find what joints are not moving, we get them moving in the proper plane of motion. Depending on what musculature or tendons are just overworking or underworking, we prescribe exercises and stretches
Mhm.
to help support what we're doing with the joints, because a lot of times when you get joints out of place, inflammation is going to come on, the nerves going to get irritated, they're going to recruit some muscles more, there's some muscles that are not going to be getting as much recruitment, and so you have to prescribe exercises and stretches to help support the work you're doing in the
Yeah.
joints, because as far as chiropractic goes, we get a limited amount of time with people in the office, and then we got to make sure that you do things to support it
Support
outside of
yourself.
here.
Yeah.
Because yeah, if I see somebody in here today on a Friday, and let's say I've got an appointment with them on Monday, right? There's still 2 days between now and
Yeah.
Monday
Yeah.
where they're living life, and we've got exercises and stretches to kind of help support what we're doing in here. So chiropractic, what I found, has been helping a lot. But as far as just general stuff that people can do without needing to go to a provider, right? And just kind of do it yourself type
Yeah.
stuff. You've kind of already hit on it. It's stretching and it's just moving the body in general. A lot of people think when they need to start getting their body moving, they got to go do a full gym routine. They got to
Correct.
be going max squatting. They got to go on these sprints, runs. Honestly, if we could get everybody on this planet just to walk a bit more, a lot of the dysfunctions that I see in here on a daily basis and a lot of the pain that people just tend to deal with, a lot of those things would decrease, because the biggest thing that is fighting us today and the biggest thing we can do to just combat the general wear and tear and just kind of help health overall is just to do some more movement. Something as simple as walking a bit more, or even if you're just watching TV all day, hey, every 15 minutes, just stand up
Stand up.
for a
Yeah.
second, do some sort of movement. But like, movement is medicine, and that's why chiropractic works so well. It's a healthcare that's completely focused on
Yeah.
movement. Movement is one of the best things that we can just do at all, just to help with health, help with your overall well-being. Plus, when you are moving and exercising, even if it's minor stuff, you get endorphins with that. You get
You
that
really
feel good
do. You
juice.
feel good.
Like it helps with depression, helps with mental issues as well. It's not going to be a perfect fix for like, hey, don't go to a counselor, but it
Yeah.
does a ton.
It does a ton. Like
Yeah,
yesterday, I ran 4.5 miles and then I did a
nice.
2 mile cool down.
Yeah.
Like
Mm,
originally,
mm,
I was just going to do that four
mm.
and a half mile
Yeah.
run. But
Mm,
after that, I'm like, you know what? I'm feeling good. So I did a nice 2 mile cool down walk. But it's
nice.
just after I exercise, run, or
Yeah.
whatever the case may be,
Yeah.
I generally feel much better. And just even with like lifting weights,
Yeah.
many people, and I'm very big on telling like my clients
Mm,
and the public and people that watch
mm.
me, not everybody's exercise journey is the same.
Nope.
Me, I run, I lift weights. I don't lift heavy weights because I
Mhm,
know what I want to do, but
mhm.
just move your body over time. Do incorporate strength training because
Yeah.
that's very crucial. But I think
Yes.
many people, the word strength training is like,
Mm,
I can only lift like 10 pounds. So I have
mm.
to go in there and just push myself to its strength. No, just do something because
Yeah.
something is better than nothing. And you
Mhm.
don't want to end up losing that your muscle mass over time, which does
Yes.
happen with age. And I don't think
Yes.
people quite understand,
Yep.
like, you have it's to me, it's a non-negotiable. You need to do it. Just
Yeah.
like stretching your body,
Yeah.
non-negotiable, strength training,
Yes.
non-negotiable. If you even
Yes.
just start those two,
Mhm.
over time, you'll be like, "Wow, I feel better," but it's just
Yeah.
a lot of it's like mindset
Yeah.
too. Yeah.
Oh, absolutely. Well, and a lot of the so my background before chiropractic was kinesiology. That's
Mhm.
exercise science. I
Yeah.
took an emphasis on physiology with that. Did some extra schooling just to get the emphasis. It's not on my diploma though, but it's somewhere.
It's somewhere. Yeah.
But a lot of the research that we were doing in the labs and a lot of things we were learning about was the different structure of musculature. You've got your aerobic musculature that's all about the running and like the long distance stuff, and then the more anaerobic musculature, that's the short burst of energy, that's the squats, the heavy
Mhm.
stuff. That truly is the stuff that lasts the longest amount of time. They're finding that people that have that muscular strength going into their 40s and 50s and 60s, the people that have more of that baseline muscular strength, not even talking about the cardio stuff, but just that ability to like, I can go do 20 air squats.
Right.
It's really helping with longevity, with mobility in our older population. There's even been some studies showing it helps with the prevention of dementia and
Hmm.
Alzheimer's,
I've
which is
talked about that before
yeah, and
too.
that's kind of a newer thing. It's really cool. And so, I mean, just the ability to move and be strong and not like go squat like
Yeah.
315 pounds, but just be like, I could just stand up and do 20 air squats right now and I wouldn't be done for the day. I wouldn't be just shot for the day. That, I mean, that it's huge in just overall mobility and health. And it's going to help you in the long haul too. I mean, it's amazing. It's amazing stuff. People just need to start moving.
Mornings hit different when you fuel like a warrior. Hydrate smart, boost energy, no caffeine crash.
So you talked about
Mhm.
passive care in
Mhm.
essence. So
Mhm.
is passive care enough, or do patients need to earn stability through strength?
So passive care, as in like stretching, not doing so much of an exercise
Yeah,
routine, sort of thing.
stretching. You talked about how
Mhm.
you like provide exercises for the
Mhm.
individuals to do.
Yeah,
So, like, is
yeah.
that always enough, or do you need to focus on like the stability issue before strength?
Stability is probably going to be the biggest thing as a rule of thumb to go for because I know there was one year, I think it was 2022, right after New Year's, between me and a colleague at my clinic, we saw, I think, between 15 and 20 like deadlift injuries that came
Mhm.
in.
Yeah,
And they were all relatively strong people for the most part too. It wasn't like people that had never deadlifted before in their lives, but they just went after it way too hard and went too heavy. And you get that New Year's craze to like, oh
yeah,
man, I haven't deadlifted in a little bit. I'm going to get back after it because I used to. And a lot of those injuries came from just a lack of stability. And a lot of my gym injuries I see here, people that jack themselves up in the gym, it is due to a lack of stability
hmm,
with the movement, going too heavy while your form's not good or while you
correct.
weren't in a good stable position. Because I mean, as far as your low back goes, I mean, if you don't have good core stability throughout your lift, it is so easy to injure yourself even on just light lifts. And core stability in general is going to be one of the first things that as you are pushing weight and you're going higher, it's going to be one of the first things that goes out. So as far as just, passively what you can work on before getting into heavier weights and stuff, I mean, stability is going to be the biggest thing you should focus on with anything. But I mean, what the original question was just what passive versus,
Um,
strength training.
yeah,
I mean, passive stretches and some of those core exercise things like building your base is always going to be better than going after things
yeah,
full haul, going in the gym and just trying to push as heavy a weight as you can. If you don't have a good base to go from before that with core strength and just good proper positioning and form, I mean, you're setting yourself up for problems down the road. So it's always better to, get your good foundation first across the board, no matter what.
yeah. And I think not many people understand that. Like, you sometimes back pain comes from not having a strong core.
Yes.
And like,
Yes.
again, like, your body is a system, it's connected in so many different ways. So
Yeah.
like, if you notice like you do have back pain, maybe
Mhm.
focus on strengthening your core first
Yeah.
and then see. But that's not always the answer to it,
Mhm.
again. But like, you could start there first before anything.
Oh yeah, and honestly, two of the biggest things you can look into to help with stability in general, and you can look these up. They're really easy to find online. You find diagrams of them. It's
Hmm.
really easy to follow. But you get things called lower cross syndrome and upper cross syndrome. Everybody deals with it. It's just kind of the way our bodies are built. We have a natural tendency to fall into these issues. With lower cross syndrome, our abs and our glutes get weak, and our lower back and our hip flexors get ridiculously tight. And then with the upper cross, it is deep neck flexors and your rhomboids, the stuff in between your shoulders that keeps you open. That stuff gets weak. And then traps and pecs get tight. And those, like, if you can fix the upper cross and lower cross syndrome, or do what you can to help with it, nobody's ever going to be able to perfectly correct it in their bodies because we're human. We're not going to be able to eliminate anything perfectly. But if you can work on like correcting the upper cross to lower cross syndrome type stuff, I mean, that's the biggest thing for like stability. If you can get those fixed generally and have those as your core foundation before going into any lift, any movement, I mean, you're going to prevent so many injuries. You're going to be stronger for it too. Might not feel like it because you got to start with lower weights to get used to it, but you're going to be stronger in the long haul for it because it's going to be more functional, powerful movement. Who cares if it's less weights in the gym? You're going to be able to do more just throughout your life. Yeah, the more functional stuff like, oh, I got to go take the trash out. That's going to be easier, you know?
True. So how does shoulder mobility affect lifting performance?
So in general, that position, so shoulder mobility, a lot of us I think I kind of touched on this earlier already. I mean, we all get stuck forward like this. Pecs get tight, traps get tight. When you get right here, I mean, automatically your range of motion's already tight. So if I keep my shoulders here and I kind of force myself to keep them here, if I try to go forward, that's about as far as you go. And some of that's an anatomy thing, some of it's a structure thing. You literally can't push through it. So you're already limiting range of motion for any type of upper body lift if your shoulder mobility is restricted due to that kind of being forward here. And as far as just, again, it's kind of like the interjoint dependence bit. When your shoulder isn't moving well, you're going to find motion in other joints. They got to take on that extra wear and tear. And even the structure of your shoulder is going to get more stressed for it. The rotator cuff muscles, if your shoulder doesn't have good full mobility overall, and you're trying to force a press up, you're going to force that through the musculature there, through the labrum even. That's where a lot of labrum tears happen too. And labrum tears and rotator cuff tears, those are the two big things that end up injuring shoulders. And if you don't have good mobility and you don't have that good transition of force when you're pressing through, I mean, it is going to affect the structure. That force is going to go through the structures that make up our shoulders. And our shoulders as a whole are really unstable. They're designed to be. There's a reason I can do like a windmill. Like there's a reason I can do that full motion. It is an unstable, very mobile joint. It's designed to be like that. So when it is like not as mobile, isn't getting as good a motion, it's going to have more force forced through, and already by design, more unstable joint, and then you're going to injure it. You're going to jack it up. It's so common. I had a guy I went to school with that he had pretty darn good form for the most part, but he liked to push his weights, and he like tore his shoulder like twice while we were in school and had to have surgery for it, which isn't great for a chiropractor to have surgery on the shoulder before they're even going out into the field, but it's super common. And he was really good about his form too. It's just he would push weights sometimes and wouldn't be in the best position, and it would be enough to jack some things up. It'll sneak up on you. Shoulders are really easy to get restricted and to put too much force through. They're unstable, wonderful things, but they're very unstable, easy to injure. Everybody's injured it at least once, I would say.
So since I know you focus on like extremities,
try to.
Injuries do you tend to see the most?
I mean, as far as just general dysfunction, I mean, ankle, and like rolling your ankle. That's the most common thing that will get somebody in here. I think a lot of times, most patients actually don't come to their chiropractor too much for an extremity issue. It's because as a rule of thumb, chiropractors are known for their treatment of the spine. And hey, that's the thing we're best at. We're amazing at it. But we don't see a ton of people coming in for extremity complaints a lot of the time. And it's because a lot of people, when they get their shoulder hurts or their wrist hurts, they just think, oh, I just got to rest it. I just got to ice it. But as far as like what I notice coming in most often, it's probably it's rolled ankles, it's rotator cuff tears. Those are kind of probably the two biggest ones we notice. And the rotator cuff tears, I mean, that just comes from these shoulders getting so far forward. And I mean, the ankle tears, I mean, that comes from your calves getting tight, and then us being in shoes that don't support general motion overall. Some are just too flat-footed and
Yeah,
they're mostly designed to look pretty. Doesn't really help your ankle move.
true.
And then we sit all day long, so your ankle doesn't get good motion as you're going throughout your day, so it will naturally get tight. And when your ankle gets tight and doesn't move well, it's a lot easier to roll it because it
Used
doesn't have
to.
yeah, it doesn't have that dynamic ability to take on force in a weird direction because it's been stuck for like 40 hours this week. And then
Yeah.
hey, you didn't see that rock when you're on that walk, so
Boom, there went your ankle.
yeah, there it goes. And then your talus is out, your calcaneus is out. Those are two bones in your foot, the big ones that make up the top of it. And they get inflamed and swollen, and it's no fun. And you got to get them moving good again.
So how important would you say ankle mobility is, such as like ankle circles, are for people that work a desk job or tend to notice that they are very sedentary?
It's ridiculously important because
Mhm.
if we're talking about probably the area of your body that gets the most work just day to day, I mean, it's your feet.
Yeah.
Even if you are sitting a lot, driving the car, you're using your foot. When you're walking, you're using your feet.
Mhm.
When you're bending over, you're using your feet. You walk on them all day long, and your ankles are supposed to move a lot. So if they're not moving well, again, it's that bad transition of force. You get more of that kind of shock happens at the joint. But the general just mobility ankle circles, I give my people ABCs. That's one of my favorite things to give as homework. You imagine a pen sticking out the tip of your big toe, like a marker there, and then you draw your alphabet with it and you go as far as you can
Can.
before fatigue or getting sore. And then, hey, when you pick it up again, start with whatever the letter you left off with. But when you do those ankle circles, ankle ABCs, it forces your body to go through like about as full a range of motion as you can on your ankle. And it reintroduces the musculature of your ankle and your kind of leg here as well. Because there's a lot of muscles that plug into the
Yeah.
foot. I mean, I could pick up the picture from the other room. There's 5 or 6 that kind of connect, wrap around here. You got a ton that kind of come down from the shin, connect into here. And there's a lot of intrinsic musculature to the foot that allow people to be responsive to motion and movement. But we tend to just have shoes on all day and
100%.
we keep them in the same spot all the time. And so you lose that muscular awareness down there. You lose the joint mobility down there. And then that's where ankles get stiff, injuries go up. Rolling your ankle becomes more common. It's where foot pain can come from. It's where knee pain can come
Mhm.
from too. So yeah, ankle circles and such. Everybody should be doing those. And I'm a hypocrite. I should do them more than I do.
Yeah.
Yeah.
So if someone can only do 3 things weekly for joint health, what would they be?
Oh, 3 things for joint health. 3 things for joint health. I would say, yeah, 3 things. Walk.
Mhm.
Walk every day for at least a little bit, like I don't know, 15 to 30 minutes. Try and get that at least every day because that's going to reintroduce movement to your body. It's going to get your blood flowing. It's going to force you to use joints that don't get used enough by all of us.
True.
And then the other 2 things would be just getting pelvic mobility in. So everybody knows how to do, in general, cat cows,
Yeah.
cat camels, where you're on your when you're on your hands and knees. You pull us up, you pull us down. Going through that, and then anything you can do to activate the musculature between your shoulder blades. So, like doing scapular squeezes right there. Because automatically, by getting your pelvis and your kind of thoracic spine mobile, you're going to be less likely to dumping out
Yeah.
when you're sitting for a long time. And if you're doing a lot of lifting every day, if you're on a labor job, by activating your lower quadrant down here, you're going to be more likely to use your core when you're lifting and when you're moving. And as far as the top goes, if you get your rhomboids moving and get them recruiting more, your shoulders are automatically going to be in a better spot. That's going to decrease the tendency for us to injure our shoulders. It's going to help the traps be looser. It's going to help prevent headaches too, because it's almost impossible to posture up here without fixing your head position.
Yeah.
So I'd say those 3 things. So rhomboid squeezes, some cat cow, anything to get this pelvis moving, less locked up like it is as we're both sitting
Sitting
here.
in it. Yeah.
And walk. Just walk. And if you don't like walk and like jog, run, do something. Just move every day.
Move your body.
Yeah, move your body. Like do whatever makes you feel good. My boss does he does cornhole, loves cornhole. So he plays cornhole like 3 or 4 nights a week and he moves his body doing that.
Yeah.
It's fun.
So now we're going to get into what is a lightning round. So I have a
Ooh,
couple of set of questions.
cool.
You'll tell me like yes or no, or you can just answer it. So the
Yes or no.
first one, what is the most underrated joint?
Most underrated joint. Ooh, most underrated joint. Shoot. I would say, yeah, I would say the ankle. That ankle. People don't realize how much your foot can move.
Yeah, yeah.
Absolutely. I'd say your talus, your ankle. There's a lot of motion that happens down there. Yeah, absolutely.
Mobility or stability first?
Stability.
Stability. Why?
So if you have mobility without stability, if you don't, so stability is like your base, right? That is
Correct.
the foundation that you are set upon. If you are ridiculously mobile, but you don't have the ability to stabilize and protect that joint, you are going to be more likely to injure
Mhm.
that joint. Ideally, you want to get stability and mobility at the same time. Kind of hard to do that, but having a good stable core to build from, you are going to be able to have a good base or foundation to have that mobility from. But if you have mobility without a solid base or foundation, I mean, it's just so much easier to kind of extend too far, tear something, rip something. So having like that stable core, I mean, just having a foundation. A foundation is always almost in any aspect of life, having a good
A
foundation
firm
first.
foundation. Yeah.
That's what always starts things off. Even in like, buying stocks and such. You want to have a good base level of revenue before you
Mhm.
want to start throwing money out into
Yeah.
the market,
Correct. So ice or heat?
Depends.
Depends.
Depends. Yeah. So I recommend both to patients. Ice, best rule of thumb, in my opinion, is if it is a new or a flared up injury. So if it's something you've never had before, or if it's something you've had before, but it's increased in intensity or pain. So
Mhm.
like I've always got some mid back pain. It's like a 2 out of 10. All of a sudden that's at a 7 or 8 out of 10. Ice is your best friend because both ice and heat are very good for pain reduction and helping with that inflammation. But the big difference is all about that blood flow. Ice will slow down blood flow. Heat's going to improve blood
Correct.
flow.
Mhm.
Oftentimes in the beginning, when your body is freaking out and it's in a lot of pain, actually increasing that blood flow, like with heat, that'll ramp up that intensity. Sometimes it'll flare things up even further. Ice will still be able to bring down the pain,
Pain level.
but it won't be encouraging that blood flow. So it's less likely for it to kind of do too much. As things get better, and let's say your 6 or 7 out of 10 is more like a 3 to 4 out of 10, heat's great because your body's not in that big inflammatory cycle anymore. So you actually want to improve
Mhm.
blood flow to help clear out that inflammation and bring good nutrients, bring oxygen to that tissue. So, like new, bad inflammation, like things are up, ice, more chill, heat tends to be better. And then in between, you can do contrast therapy
Okay.
doing both.
So barefoot training, yes or no?
I think it is great to do that. I think that that helps really develop that intrinsic foot musculature. If you got stinky feet, be careful at the gym with
Yeah.
that. But I think it's amazing. You have to be careful, I think, with that because I think is we are as a society so used to wearing shoes. So I think when people go from training with shoes to I am all of a sudden barefoot training for like a full
Mhm.
hour, that can be a bit much at times. There's a lot of people that you see with those barefoot shoes,
Yeah,
with
I've
the
seen
toe
those a
shoes.
lot.
They tell you with those shoes, you want to like don't go to a full day of wearing those. Like wear those for an hour a day
Mhm.
at first. It's sort of the same thing with working out. I think you don't want to go full on into barefoot
True.
training, but I think sprinkling that in to your workouts is great. If you can transition to it, it's wonderful because that's really going to develop the intrinsic musculature of your foot. But you might have to do that more at home. I don't know what the barefoot policy is at most
Yeah,
gyms.
some gyms, yeah.
Yeah,
Like
something.
if you're
Yeah,
at home, do some home workouts,
yeah,
don't put any shoes on.
yeah,
So yeah.
yeah. But great though.
Foam rolling, helpful or hype?
I think it's very helpful if done properly. Because there was a guy that a friend of mine knew. He foam rolled his TFL, which is a little muscle right here in your hip. He rolled that a lot before he was like racing the next day, and he rolled this too much, and it went into spasm, and then he couldn't race the next day. But like general foam rolling for like quads, hamstrings, some of your paraspinal musculature in the back, generally it's great. You're going to get some overall mobility to the areas. You're going to increase blood flow to the areas. You can maybe break up some of the fascia as that will get tight over time. So in general, I think it's amazing. I think at times it can be a little overhyped because it's not a, it fixes everything sort of thing, but it helps. I'd say it helps everything. It doesn't fix everything, but it helps.
Just a great supplement.
It's wonderful. Yeah. It's never, just like anything, it's never going to be the be all end all. It's not going to fix everything, but it, in my opinion, it helps so many things. If everybody foam rolled a bit more, we'd probably all be the better for it for the most part. Unless you're rolling your TFL for like an hour, then that's bad.
Yeah. So what is one thing you would like our viewers to know?
Like the viewers to know. I mean, I'm the chiropractor in the room. I would love people to know that chiropractic is not just for pain. It's not just if I have a headache, if I have mid-back pain, if I have a pinching in my foot, I need to go see the chiropractor. Most often, that pain it's a subsequent sequence of events that this kind of came on. I had a patient come in not so long ago. They had rib pain. They just woke up with it, and they'd slept on their back, and they didn't do anything strenuous the day before, or the day before that, or the day before that. They just woke up with that rib pain. It wasn't because they did something wrong in the last like 24, 48 hours. It's just because over time, their thoracic spine had not been moving well for a very long period of time. And they used their thoracic spine and their ribs every day because they're very involved with breathing. That's what your ribs do. They flare in, they flare back. That's how the biomechanics of breathing happen. But since their mid-back wasn't moving well, that rib was moving inefficiently over time. It continued to have that bad range of motion. And it got worse and worse and worse over time. And their body was able to compensate, keep up with it. And then all of a sudden, that one night of sleep, that, I don't know, millionth breath they took with some bad mobility right there, that's what thunked it out. And it took us a while to get that rib to want to stick in place because the body had been working up to that point where it fell out and the body liked staying in that position. But if we'd had them come in maybe 3 months before, 2 months before, we probably would have found some restriction right around the area there. It would have been really easy to get that sucker moving. I probably would have seen them like today. If I'd seen them today, this Friday, I probably would have told them, hey, come back next week. We'll look at it. Most likely it would have held pretty darn well since they've gotten ahead of it so far. And I mean, I wouldn't have to do much of a care plan with them. Wouldn't have to even have much of a treatment protocol with them because we caught it before it got to that point. And that's where most musculoskeletal body pain comes from. It comes from bad movement over time, then all of a sudden it snaps. It is always going to be better for the prevention of ankle pain, hip pain, neck pain, headaches, mid-back pain, ridiculous symptoms going down your arms and legs. It's always going to be better to go see a chiropractor, see how your body's moving, find where it's starting to go wrong before you get to the pain. Healing's going to happen quicker.
Yeah.
You're not going to have to deal with that pain in the first place. You catch it before it kind of snowballs. And so it's just a chiropractic. It's not just for pain. It's for overall good movement, body mobility, and just healthy life.
So
in general,
I like to say exercise is like routine maintenance for your body that you would do for your car.
Yes.
Now I want to say like chiropractic care is perfect routine maintenance for your body as well. Especially since you're saying like don't come when you're hurting. Like just come in and see, especially if you notice your routine is so repetitive over time, like you don't know how your body is compensating. So come in, just if you can, at least come in when you're not hurting to see how your body can feel.
Absolutely. And you're using the car analogy. I use that so much with my patients. I tell people that chiropractic, in essence, it's like an oil change, right? My car, as long as my car's got oil in it, it's going to run. I don't necessarily have to change the oil. If it's got oil, it's going to run. But over time, if I don't change that oil, it's going to gunk up. The whole engine's not going to work well. And eventually, I might have to replace parts in that car. I might have to replace the whole darn car.
True.
Thing is, with cars, you can always get a new car. You can always get new parts. Our body, we only get one of these.
Yeah.
You got to take care of it. And, and you can make the argument like, hey, you can do some replacement on it. There's knee replacements. There's people that get fusions on their body, all sorts of things. Longevity on those isn't great. Success rate on those is getting better every year, but it's still not great. It's always better just, hey, take care
Of your
of your
what
whole
you
system.
have.
Yeah, take
Yeah.
care of your car. If you take care of your car, it's going to last you the long haul. It's a very resilient system, and it responds really well to just maintenance care, exercise, mobility. If you give your body the right tools, it will perform, it'll move well, and it will last you a long time.
So thank you all for watching Health Huddle, What's Working in Health and Fitness. If you don't know already, chiropractic care is working for you and your body. So if you have the opportunity to go to a chiropractor near you, go find one. Make sure you try to go when you're not hurting and see
Mhm.
how you can help your body in the long haul. Thank you again for watching. This is Health Huddle.